Hi, my name is Dr. McKenzie. I am a chiropractic neurologist, and I'm going to be talking about many different conditions, and I'm going to start with attention deficit hyperactivity disorder. So first of all, some of the symptoms that are associated with attention deficit hyperactivity disorder are inattentiveness, impulsivity. Impulsivity would mean that somebody cannot inhibit certain behaviors. Hyperactive, saying things out of turn. Symptoms always start in childhood. So with ADHD, if a person didn't have it as a child, they don't have it as an adult too. For some people, the symptoms go away later on in life, but depending on how the frontal lobe develops. And so also, what we see with adults, though, is we see trouble with time management, or inability to be organized, or inability to set goals, or follow through with their goals. A lot of times we see inability to hold down a steady job, and we see issues with relationships. A lot of these things we also see with other types of frontal lobe disabilities as well. Trouble getting organized. Sometimes we see reckless driving, marital trouble, poor listening skills, general recklessness, trouble starting a task, angry outbursts, prioritizing issues is a problem, extremely distractible, and poor decision making. In other words, because this part of the brain it doesn't work very well, it's hard for people to make good decisions. So a lot of times they just go from one bad decision to the next. There's actually different types, there's 3 different types of attention deficit hyperactivity disorder. There's the inattentive kind. This used to be called attention deficit disorder, or ADD. This is, we see daydreaming, disorganization, and people just making careless mistakes. Kind of they're on autopilot and they just get used to always doing the same thing, and then so a lot of times they're not thinking very much about what they're doing. Then there's the hyperactive impulsive type, where we see a lot of fidgeting, non-stop talking, and impatience, and then there are people that have the combined forms. So these are the 3 types. There is a genetic tendency, as we know that this tends to run in families. If you have a parent that has it, your chance goes up by 50%. And if you have a sibling that has it, your chance goes up by 30%. By the way, about 8% of children have attention deficit hyperactivity disorder. So that number is going to be less than adults. Probably about half that number in adults. A lot of times we see that low birth weight is also a factor. Being born prematurely is a factor. Difficult, if your mother had a difficult pregnancy, it's more likely that you'll have attention deficit hyperactivity disorder. If you've had any kind of a brain injury to the frontal lobe, a lot of kids hit their head, and these kind of things can play a role in having this. Alcohol consumption while pregnant, it can affect the child's ability for the frontal lobe to develop appropriately. Or if the mom smokes while she's pregnant. And then of course different kinds of things in our environment, like exposure to lead, PCBs, or pesticides, this can interfere with brain development. So if the mom consumes them when she's pregnant, it can affect the offspring. But also, if we consume those things, and while our brain is supposed to be developing, it can affect the outcome as well. And if you look at the grains that we consume and how much pesticides are on them, and just many other things that we consume, we're getting a lot of pesticides. And different people are more likely to develop ADHD, especially if there's already a genetic predisposition, when we create an environment that is conducive for turning on these genes. What we're dealing with here primarily is abnormal neurotransmitter levels, especially dopamine receptors. So there's a neurotransmitter called dopamine. there's a pathway called your frontoneostriatodopaminergic pathway. This pathway doesn't work very well with ADHD. And so it can be that the receptors themselves are not being able to be stimulated, or maybe some people are born with less receptors, and this might be the genetic predisposition. But there's things that we can do to increase the receptiveness of these receptors, which will make the brain work better, but also we can help the body make more dopamine. And dopamine, there's a lot of different things that go into making it that have to happen in order to have adequate dopamine to the brain. And so that's one of the reasons why we like to look at nutritional status, and we also like to look at various aspects of blood work. So for example, if you have hypoglycemia, you'll have a hard time making dopamine. So if we want to treat ADHD, then we have to regulate blood sugar as well. So what's interesting about ADHD is that what we always see is that there's decreased frontal lobe function. And frontal lobe is the part of your brain that determines your personality. It's what determines motivation, ability to follow through with goals and make goals. It's the one part of our brain that allows us to have meaningful relationships. It allows us to enjoy life. It's what makes us human, and it's what sets us apart from the beasts of the field. Our frontal lobes are much more developed than any other form of animal, and it's also our intelligence. What we see we see dysfunction, and or we also see literally decrease in size of the frontal lobe. And what happens is, what we see in the actual cortex, which is the outer part of the frontal lobe, we see a decrease in theta waves and alpha waves with brainwave activity. So if we can measure brainwave activity, which we now can in our clinic, we can actually measure these things and we can quantify them. And we actually have what's called a quantitative EEG, where we can light up the parts of the brain that aren't working very well, and we can go right to those areas and we can localize them and work on things to change their function. We can also find out which areas are working too hard, that are not being inhibited appropriately, either because certain parts of the brain aren't working well and so other areas have to work too hard, or because of neurotransmitter imbalances. And then the limbic system relates to mood swings and quick outbursts. So usually what we see with ADHD is that the limbic lobe, which is on the inside of your brain, and it's next to your temporal lobe, we know that this area is basically working too hard. So as we increase the function of the frontal lobe, then the limbic lobe starts to calm down. There's also another area of the central nervous system that's involved, and that's called your reticular activating system. The reticular activating system, I'll just tell you how important it is. If a person's reticular activating system is damaged bad enough, they go into a coma. And so this is something that's very important, but we know that theirs doesn't work as well, a person that has ADHD. So this is where thoughts and feelings meet in the brain. We see quick to startle. In fact, a lot of people with ADHD still have some primitive reflexes like the startle reflex. So that's something that is worth checking, and if it exists still, and it's supposed to go away all by itself, we want to work on getting rid of that primitive reflex, and that helps the brain work better. There's a lot of hypervigilance. We see a lot of insomnia. We see decrease in motivation. So this reticular activating system requires both serotonin and norepinephrine, which is one of the reasons why SSRIs are sometimes used for ADHD. It's for this particular area here. And this determines whether or not a person can learn or remember things. And this is where we can see motivation versus boredom, or impulsivity versus self-control. It all takes place in this area of the nervous system. So we know another thing that's very interesting about people with ADHD is that studies show that they are very insufficient in essential fatty acids. Now, when we're talking about essential fatty acids, a lot of people are thinking to themselves, does that mean I should take fish oil? And the answer is yes and no. The reason why I say that is because most fish oils have the wrong combination of essential fatty acids in them. What you're going to want is to look at the fish oil that you're going to use, and you want it to have a high level of DHA versus a low level of EPA. Most of the time when people buy fish oil, they're getting the reverse balance. And so what happens then is that they get help for their cardiovascular system with that kind of a balance, but they don't get a lot of help for their brain. So when we want to help the brain, we specifically are looking for DHA, and we can get those supplements for our patients to help their brains work better. So we know that essential fatty acids help improve cognitive ability and with general behavior. And if you consider what DHA is, it's basically the fat that we need for our brain to function. So with a lot of people's diets, they're not getting good fats, and a lot of people have trans fats in their diet, or they're getting the wrong combination of omega-3s versus omega-6s versus omega-9s. So omega-3 is what we need way more of, and we specifically need more DHA, and that helps with the entire body rather than just the cardiovascular system. So the common medications for ADHD are SSRIs. What are we trying to do with these kind of medications? We're trying to recycle the serotonin that we need for the reticular activating system. And the problem is that you're trying to recycle what you don't have enough of. And so in this kind of situation, the best thing to do would be to actually help the person make more serotonin rather than trying to recycle the little bit that you hardly have, which basically, there's side effects and adverse reactions. So anyway, you can also use tricyclic antidepressants as well, and this helps some patients. Some examples of some of these medications are Stablone, Coadil, and Tatinol. We already talked about essential fatty acids. There's a supplement called Dopatone. We have another one called Serotonin. Serotonin, if you know, for example, that you have ADHD and that you're already responding to an SSRI, then Serotonin would probably be the supplement to use. And a lot of people would probably respond to a combination. So with what we do at our clinic, we have something called CNS vital signs. This is used not just by us, but even the Mayo Clinic uses this. This is developed by a medical doctor to measure neurocognitive abilities. And actually, based on the outcome of the test, we can end up with these really cool graphs that show us, what is the chance that this patient has ADHD, or that they have dementia, or that they have some other condition, just literally based on the test outcome. This is very useful because we can remeasure and we can see the change in basically motor versus brain function. So basically we're testing how the brain produces motoric function and an outcome, and based on the outcome it gives us a very good idea of what's going on in somebody's brain. But not only that, with our patients we have them do something called a neurotransmitter assessment form. Based on this form, it gives us a really good idea of what's going on with the biochemistry of the brain. So it helps us figure out if there's a problem in the brain's ability to communicate to the body with hormones. Also, we can figure out, just based on symptoms, is the patient most likely hypoglycemic, or is their blood sugar spiking and going too high? And then we can do blood work to confirm that. We can also figure out which neurotransmitter most likely is the most likely one that the patient doesn't have enough of. We also do something called a brain region localization form. So based on symptoms, we can usually localize what part of the brain, and then we confirm that with our quantitative EEG, where we can actually measure it, and we literally can map out the brain and do things to change function with something that we call the NSI, the Neurosensoromotor Integrator. We have very specific programs that we can use that we can use for patients with ADHD to change function. What's so cool about this is that we can actually map out and graph out improvement with patients, and so we can see as they get better and better, their ADHD should also improve. So the drug of choice that most people are using now that have ADHD is Adderall. So many kids are taking it, and you know, this is technically an amphetamine plus something called dextroamphetamine, which basically is a sugar added to the amphetamine. This is very addictive, and it can cause, actually, it can lead to a stroke, it can lead to a heart attack, heart disease, or it can cause heart defects, it can cause high blood pressure, and it can cause psychosis. And people that have a history of depression are way more likely, or other mental health issues are way more likely to become psychotic from this drug. So if you ask yourself this question, if a frontal lobe already doesn't work very well, and we know that psychosis is severe frontal lobe problems, why would you want to give somebody a drug that can make it work worse? And the problem with the drug is that the drug doesn't create any kind of neuroplasticity. In other words, it doesn't create any long-term benefit for the brain. It's true that it can help with function in some cases, but it actually, without changing the plasticity of the brain, in other words, without changing its function, what we know is that the brain will atrophy. And so, do you want your brain to atrophy more and then have more issues over time, or do you want to actually start changing how the brain functions itself? And, you know, what I like to promote for my patients is the latter of those two options. Okay, so these are the contraindications, and maybe people should be looking a lot more closely at this before they start taking the drug. But if you have circulation problems, and this can include circulation in your brain, glaucoma, overactive thyroid, history of drugs or any kind of addiction, history of anxiety, history of suicidal thoughts, seizures or epilepsy, an abnormal EEG. And by the way, we're going to be seeing abnormal EEGs when we test people, and we're going to see that everybody that has ADHD is going to have an abnormal quantitative EEG. If somebody's pregnant, it can cause a low birth weight or premature, or it can cause a premature situation. And you notice that we said earlier that low birth weight can lead to ADHD. So, you know, if you're pregnant and you're taking it, your kid will have the genetics for it, as well as low birth weight. That increases their chance of having it as well. And it's contraindicated if you're breastfeeding or if you're below the age of 6. So anyway, if you're interested in a consultation, just this is our contact information up here. And you can get a hold of us and we can schedule a consultation. If you have any questions, feel free to contact us and we'll try to respond. All right, thank you.